So today the question is that I'm going to do is are fibromyalgia patients immunocompromised? So the answer to that is most of the time, but not all the time. Okay. So I mean, this really goes back to we have a fibromyalgia presentation that's about an hour and 10 minutes long online. And it's called Fibromyalgia, the No BS series. So I'm not going to take an hour and 10 minutes to go over this, but this goes back to fibromyalgia, right like from the beginnings of it, when it was like chronic fatigue immunodeficiency disease, okay, back in the 80s, 90s. And we had to come up with a term, so the term ended up becoming fibromyalgia. And it was really a term for, and it still is in many doctors' offices. It's a term that means fibro, it means muscle pain, and it means pain in muscle fibers. We now know today that the pain probably generates from a lot of other places, and more primarily nerve fibers and inflammation and things of that case. So the term really is kind of outdated, and there's a reason I'm going into this, okay? Because in the end, it's a diagnosis of exclusion for your rheumatologist. Like if their lab tests all come up normal, your MRIs come up normal, your CAT scans come up normal, they poke you. Some people still do the poking. They poke you like, 18 different places, and if you're tender in 11 of them or something like that, then they say you got fibromyalgia, which is completely, totally meaningless, just for the record. Okay, so fibromyalgia is more complex than that. Now, so the question is fibromyalgia an autoimmune problem? And I think I was in one of the earliest groups of studying these things, and it was at that point thought it's got to be autoimmune. What else could it be? Because there's all of these symptoms, and everybody is telling you that your labs are normal, everything's normal, there's nothing wrong with you, go see a shrink. For those of you who are shrinks, go see a counselor. And maybe it's in your head, and maybe stress, and so on and so forth. And it's not. It's a real condition, and part of it is autoimmune. And we saw a large part of it was autoimmune. Okay, but a lot of times, my whole point of that whole diatribe was, a lot of times people are diagnosed with fibromyalgia, and maybe 25% of the time, it's not autoimmune. Sometimes it's just a massive misdiagnosis. I mean, I've had people come in here lately with just significant musculoskeletal problems where they got injured and they just have set things off, and the practitioners didn't know what to do with them. They couldn't help them, so they told them they had fibromyalgia. And it turns out that they just maybe weren't great practitioners, and we referred them to another person to take care of their neck, physical therapy, chiropractors, and these patients got better, and they didn't have fibromyalgia. They had a misdiagnosis. So fibromyalgia, I would say 75% of the time the person comes in here with a fibromyalgia diagnosis is going to have some sort of autoimmunity. The things that we see, I have a case right now that I think, if I put them on the 25%, I think it's a very significant chronic stress case, which I hate because everybody's already told that person they're stressed out of their mind, and then I initially lose credibility until I explain to them, I'm not saying that your stress just calmed down. I'm saying you're in a chronic fight-flight response that just won't shut down, which is an entirely different thing. But that alone can affect everything. It can affect your gut. It can affect your blood panels. It can affect everything, your chronic stress response. And then ultimately you have a number of systems involved, and then you start getting joint pain, and you start getting inflammation and muscle pain. And that would be the symptoms of fibromyalgia, but that person doesn't have autoimmunity. They have other issues that are causing those tenderness, the muscles, the pain that comes and goes, the fatigue when you overdo it, and so it's not always autoimmune. It's not always autoimmune. And if it is autoimmune, it usually isn't one autoimmune problem. It's frequent, I mean, for myself, I have Hashimoto's, I have celiac, I have autoimmune gastritis, and I have antibodies that say I could develop diabetes type 1, but I probably have developed a mild cerebellar ataxia, which means that if I eat certain things, I could get a little bit of imbalanced. And so that's more of a fibromyalgia, if you want to call it that, because I was more or less diagnosed with that years and years and years ago. And that's how I got into this. So, I mean, I don't mean to be confusing, but the point is that no, if you have all the classic signs of fibromyalgia, you have tenderness, you have joint pain, your bowels are issue, you're fatigued, your hair is falling out. A lot of those are thyroid symptoms, and in some people they're not. A lot of those can be blood sugar symptoms. And people are hugely undiagnosed with blood sugar problems. It's like if you don't have diabetes type 2, or you're not like passing out from being severely hypoglycemic, then doctors don't think blood sugar is a big player. But let me tell you something, all your muscles need blood sugar. And if your blood sugar is screwed up and it's going all over the place, you can have muscle pain that comes and goes. Does that not sound like fibromyalgia? So you would use the term fibromyalgia for that if you were several doctors, rheumatologists and so on and so forth, that don't either investigate that can cause the blood sugars. It can cause joint pain, it can cause anxiety, it can cause depression, it can make, if you have bipolar problems, it can make it worse. It can cause insomnia, night sweats, heart palpitations. A lot of these things are things that fibromyalgia patients have, but it's a blood sugar component, and the blood sugar can affect the thyroid. So now you get the thyroid symptoms. So I'm not trying to be confusing, but this is what you're asking a doctor to understand when you walk in with this constellation of symptoms, and you talk to the doctor for 10 minutes, and you look at them, and their eyes are kind of glazing over, because it's just like, they're like, wait a minute, that symptom should be this, and this symptom should be that. The things they see the most with fibromyalgia patients, okay, to kind of wrap this up. I see Hashimoto's type of problems in probably 70% of the people who come in here with Hashimoto's diagnoses. I actually see blood sugar easily as much, if not more, involved. Stress responses, yes. I mean, I almost think there is not a fibromyalgia patient that's ever walked into this office that has not had some level of a chronic stress syndrome going on. That's shutting down their gut, that's altering their ability to digest foods, that ultimately maybe they have interstitial cystitis, maybe they have bladder dysfunctions because they're in chronic fight-flight and it's shutting that down, and then all of that cascades into a bunch of other things, and that screws up your blood sugar. So stress is a big one. Autoimmune thyroid disease is a big one. Blood sugar is a big one, and then a lot of these things all result in bad gut function. People don't like sit and go, why do I have bad gut function? This is why I have bad gut function. And so all of these things will create bad gut function, which in and of itself then blows up into H. pylori, candida, small intestinal bacterial overgrowth. This is fibromyalgia. This is fibromyalgia. So fibromyalgia, again, means pain in the muscle fibers. Wrong. Well, it could be pain in the muscle fibers, because I just said if the blood sugar goes up and down, that'll cause pain in the muscle fibers. That'll cause joint pain. But it will cause pain in the muscle fibers. Inflammation kind of causes pain in the muscle fibers, but a lot of stuff doesn't. So really, it's that full clinical picture that defines fibromyalgia. Now, back to the question. So, does everybody that has fibromyalgia have autoimmunity? No. Though a lot of people that have fibromyalgia have autoimmunity. Yes. Again, in my observation, I've been treating fibromyalgia for a long time now, like a long time. And so I would say 70%, 75% do have autoimmunity involved, and I would say 25% do not. And that would be my estimation of the answer to that question.